Hello, Dr. Seema Segal. So you are a practicing psychiatrist in Fremont. Can you give me a little bit of introduction about you?
Sure. Rupali, it's so good to do this again with you. I'm a psychiatrist in practice in Fremont, and I have over about 25 years of practice dealing with a wide range of mental health disorders, from the chronic, severely ill people who have schizophrenia, bipolar disorder, severe depression with or without psychosis, all the way to people with dealing with anxiety, generalized social anxiety, and everything in between. So I'm so happy to have this opportunity to educate and share some of my experiences with your viewers.
Thank you so much. So today we were going to tackle some of the stories that have been shared on our platform. And one of the questions I had about growing up in a family where one of the family member or a parent or a sibling has some kind of a mental illness. So, what are some of the emotional responses that a child, when they grow up in this kind of a household, what are they feeling?
This is a really, really important topic, Rupali, because I see patients who either as youngsters have grown up in a family where one parent or a family member has suffered, a major mental illness. And they themselves have then grown up, to have sort of difficulties and challenges with their own mental health as they went into adult life. But as a child, some of the emotions that they can feel is a spectrum that can include fear, confusion, worry, feelings of guilt, feelings of shame, not understanding really what is happening within the family system. Because, one family member, it could be a parent, it could be a sibling, is suffering from a major mental illness, which is a really disruptive event in the family.
Yeah.
And, depending on the age of the child, when they are exposed to this, the responses can also vary. Because if you think about it, the maximum time of brain development is happening till the age of 5.
Mhm.
And in that time, the most essential, things that the growing toddler needs is bonding, strong attachments, continuity, consistency, dependability, predictability of the parental figure being there.
Yeah.
And when this is disrupted, it can lead to a variety of mental health challenges. If it is an older child, if it's an adolescent, at that age, what you need is you want parental approval, you want reassurances, you want structure, you want sort of the accolades from your parents that you're doing a good job, because you're building your self-esteem and self-worth in this time.
Yeah.
So, depending where you are in your own development, when you have to face something like this in the family, the responses can vary.
Yeah. Wow. That is, I mean, the stories that we have done, I think it's really important to hear what you just said. So, even for a partner or a spouse who is supporting um, a partner who has mental illness, right? How do they take care of themselves? How do they keep their sanity? And what are the signs that they need help, if any? Yeah.
This is an important question because, again, unfortunately, in this country and in many others, there is not the concept of treating the whole family, as one unit, because you can imagine how disruptive it is for every member of the family. And the, family system is a very closed system.
Yeah.
So stress in one part of that system automatically impacts every other, piece of that system.
Yeah.
And the spouse or the well parent, if you will, uh, ends up having to carry double the burden of not just taking care of his or her spouse who is struggling or suffering and needing their help, but also making sure that the children are doing fine and keeping their school and activities going along with their job.
Yeah.
Because financial insecurity becomes a real issue when there is parental mental health challenges.
Yeah.
So as a result of this, there is a high risk of caregiver burnout.
Yeah.
There is a high risk of, the well parent not even being aware that they need help and support of their own. So some of the, signs to watch out for are lack of sleep, irritability, snapping at the parent or the spouse,
Mm.
absenteeism from work because you're too tired to really show up at work, difficulty focusing, attending, concentrating on your work tasks.
Yeah.
Sometimes the men will resort to substance use or maladaptive ways to deal with this amount of stress.
Mm.
So anything that signals to you that you are not at your baseline, not where you are used to normally finding yourself every day, is something to be aware of. And so to have, supports for yourself in place, having a trusted friend or family member, it could be, a friend at work, it could be a family member here or in India, even someone from your religious community sometimes can step up to, help. And for that, it's really important to talk about your struggles because people can't help you if they don't know what's happening with you.
Yeah. Yeah. No, I think I totally agree about talking about it. And I think that's why we are also creating this whole platform about sharing stories. So that really validates it. Let me ask you one more question. So you talked about the well spouse, but what about the children, right? As they are growing up, what do they carry over when they become an adult, right? Like if they have a parent, like what are, you know, let's talk about a little bit of impact on these children as an adult.
Okay. That again is an important point because I always feel that a penny of prevention is better than an ounce of cure. And you want to come in and prevent mental illness from occurring in the first place. So, mental hygiene, mental health is not the absence of mental illness. It's about what we do every single day to keep ourselves mentally well. And when a child is growing up in an environment where there is not clarity of what is happening, around them, all they can see is that there is unpredictability. They don't understand what's happening. There are difficult emotions, in the home. Parents look worried. Nobody's talking about where the worry is coming from. They see a change in behavior in their parent or family member. And yet they have to continue pretending everything is okay when they're outside of the house because they feel ashamed. They have a sense of guilt. And when there isn't open communication, the fear generates a feeling in the child that in some way they must have been responsible for the distress the family is experiencing. So this leads to low self-esteem. It leads to a sense of, low self-worth. And you can see as this child, goes on to become an adult, not only are they under sort of, have the risk of inheriting the mental illness, because there are mental illnesses like schizophrenia, bipolar disorder that have a very high genetic predisposition. And so they have that. They also have, they're facing adverse childhood experiences. Their environment is not conducive to giving them that sense of self that they can, take into adult life with them. So they are more prone. A third of the children of parents who have a serious mental illness are at risk of developing a mental illness themselves. So, anxiety, depression, low self-esteem, social anxiety, all of these are, things to watch out for as this child becomes an adult. On the other hand, though, if there are resources and there is help that is put in place for this child, we do explain to them what's happening. We sort of let them talk about their fears. We give them answers that they're looking for. We define their role in what is happening in the family. That can build actually resilience, growth. We see that these children actually grow up to be more compassionate, more empathic, and end up being much more sensitive parents themselves to children when they have them. So again, it's really important in how we deal with the children as they are going through this stress themselves.
So when you talk about this thing, right? When you say we as in professionals, right? The professional field of psychiatrists and the healthcare providers, right? That's what you mean, the counselors?
Yes, I mean that primarily, but in a society where there is so much stigma attached to talking about mental health issues, oftentimes it ends up being family members that step in and
Mm,
have to be that, de facto counselor for the child,
mm.
because access to someone trained to do this often doesn't happen.
Yeah.
And so, again, if the parents are really sort of engaged in dealing with this major stress in the family, to then enlist the help of a trusted adult, which could again be a sports coach, it could be, a priest, it could be a family member, but some dependable, responsible, trusted adult who can step in and be that sounding board
Yeah.
and just help the child sort through what is happening. It could be a teacher or counselor at school, even.
Yeah, yeah. Great. I'm so glad that you could answer, you know, I think it's a much needed thing. Whenever you talk to somebody about this, everybody has like, okay, so this person in my family has it, but we don't know how to deal with it. So I think with your insights, I think we will be able to make it a little bit more, resource friendly. Would you also share some of the resource at the end of the video? Uh,
Sure, sure, I will. And, Rupali, I could not agree more how important this topic really is, because, we talk about the stigma in sort of, in a way that the person suffering from the mental illness is the one who is feeling stigmatized and trying to protect themselves from feeling stigmatized from society, or, even within their family or community.
yeah.
And I really feel for the parents that I see in my practice, because I'll have mothers who, have a major mental health issue that they are dealing with. They are in treatment, and yet the fear of being an unfit mother is somehow even stronger and more powerful than the stigma of having a mental illness. And
Yeah.
so a lot of times, they will not talk about it just from the fear of legal services, child protective services, the school system sort of picking up that something is amiss in the house, and they may be separated from their children.
Yeah.
And I want to really emphasize the fact that even though these mental health disorders, a lot of people don't know the details and how severe they can be. I just want to clearly say that they are treatable. They have symptoms which, when untreated, can lead to, a lot of disruptive behavior and a lot of symptoms that are hard to understand.
Yeah.
But if you educate yourself and help this person get the treatment they need,
Yeah.
oftentimes, I would say about, 70, 80% of the time, we can go back to a very healthy family again.
Yeah. So the timely intervention is really the key.
It is. It is.
Yeah. Great. Thank you so much, Dr. Seema Segal. Appreciate your time.
You're welcome, Rupali, and look forward to chatting again with you.
Thank you.